Good morning. Thank you for joining us here today. My name is Sara Labelle. I'm a board member with the Ontario Health Coalition. Natalie Mara, the executive director, could not join us this morning as she's in recovering from surgery. The reason we're here today is because we are very, very concerned about the bill that was leaked yesterday by the NDP. The Ontario Health Coalition represents over 400 organizations, everywhere from students groups, seniors advocacy groups, health professionals, physicians, students, unions, and member donors who actually join and have joined together to actually fight to protect public health care in the province of Ontario. Our mandate is to ensure that public delivery and public services are provided in every community in the province of Ontario. As I mentioned, we are very, very concerned about what the document that was presented yesterday says. This is a preliminary report. It is an 80-page document that will have to be fulsomely reviewed by our legal and by our member organizations. We're very concerned because this bill is a major restructuring bill. There was no public consultation. There was absolutely no mention of this leading into the election. Where is the mandate? Where were they given these extraordinary powers, and to what end? There is deep consensus across the healthcare field and in communities that regional planning is the right thing to do for healthcare. And the flaw of the LHIN's legislation was that it didn't actually require public consultations. They were undemocratic, unelected. There was no mechanism for meaningful public input. Their mandate was actually to amalgamate, integrate, and transfer services. They did not actually measure or plan to meet healthcare needs in communities. They didn't look at how many hospital beds were required in communities, how many long-term care beds, how much home care was required. Or they didn't measure or plan for the geographic needs or for the population growth. As long as the Ford government listens to those people who have been the prime beneficiaries of healthcare restructuring for the past 20 years, as long as they listen to the Reuben Devlins of the world, the very people who have enriched themselves from healthcare restructuring, then health planning will happen in their interests and not in the public interest. And that is why there should actually be public consultations and a proper policy-making process. Otherwise, they will continue to be skewed on private interests. In the bill goes much further than just taking the existing LHINs and piling them into one super agency. It gives that super agency new powers to order any healthcare service provider to contract out any part of its supply chain or procurement. And this is done without limits or definitions. For example, this could actually order privatizations of whole swaths of healthcare in our communities. They can also order them to privatize the services to a supplier it chooses. It eliminates all the progressive public interest amendments that we achieved under the LHINs. We achieved legislation that required open board meetings, public consultation. There was an appeals process. All this has been eliminated in this new documentation that is to be tabled in this draft. All of that is gone. It gives the power to create mega mergers, the likes, and massive restructuring, the likes that we have not seen in the province of Ontario. And if you remember, under the Mike Harris years, there was massive restructuring of public health care. Hospitals were merged. We went from 250 down to 140 hospitals. It cost $3.9 billion to save $800 million. The power to order privatization in this bill has never existed in Ontario. The restructuring powers are on an entirely new scale. There is absolutely no reason to have pulled out of all the democratic protections, paltry as they were under the LHINs. We're very concerned about what this means for home care. The only piece of public home care that currently exists is under the LHINs. It was the movement of the CCACs into the LHINs. There are actually frontline health care providers that are providing home care under the LHINs. What happens to those services? If they privatize the only piece of home care that exists in the system, the Ontario Health Coalition is prepared to go to war. It is something that we have fought long and hard for, and it is something that is very much needed in the province of Ontario. It is a dire situation for people requiring home care. They have no mandate to turn over the only public home care piece to for-profit interest. We took a vote at our assembly in the fall. We do an assembly every year with our organizations and come in to discuss the direction and the action plan for the Health Coalition. And every single person that attended the assembly is on board with fighting to protect public health care services in the province of Ontario. Doug Ford should make no mistake. No one supports privatization of our healthcare system, and we will not tolerate it. The people did not vote for this. If he had been clear leading into the election that his plan was to privatize healthcare services, that the way that he was going to eliminate hallway medicine was actually to contract out and get rid of services in communities, the people of Ontario would have made a different decision. So we will hold his feet to the fire on this. We will make sure that the need and the population and the aging, the seniors in our communities, the people that paid for these public services will have those services in their community. And our response to the threat of privatization will be commensurate to how far they plan to go under this sweeping bill. The people on Ruben Devlin's committee, Ruben Devlin, as you all know, was a former CEO of Humber River Hospital. He was involved in the closing of 3 hospitals, Northwestern, Humber Memorial, and York Finch. They built a mega hospital at Keele and Wilson that was a P3 that had loads of issues when it was built, and those issues continue to exist. He is a personal family friend of the Ford family, and he is in favor of privatization of public services. There are other people on the board, this hand-picked board, that are executives and board members of home care companies like St. Elizabeth. People like Michael Decter and Shirley Sharkey. How do they get to transform healthcare in their interest? The Adelsteiny Brown, he was the lead in health system transformation in the McGuinty government, and we know what we went through in the McGuinty government. These people have an interest in creating mega mergers and empires, and they are the ones that benefit and profit from these massive amalgamations and restructuring of healthcare. And we will fight them every step of the way to make sure that healthcare is delivered in the public interest. It is meant to provide a service in communities, and that should be the mandate of restructuring of healthcare. We all know that there are many ways that we can make improvements in the healthcare system, but it is not to introduce more privatization and give the ministry overreaching and overarching powers that have never existed in this province before. So I'd like to thank you for coming out today, and I'm going to introduce Chris Buckley from the Ontario Federation of Labour.
Thanks, Sarah, and thank you for being here today, folks. My name is Chris Buckley. I'm the president of the Ontario Federation of Labour, representing 54 unions and 1 million workers across the province of Ontario. Before I get started, I want to thank the NDP for bringing this to our attention yesterday and educating people across the province, potentially what this government is about to do. The Labour movement is going to fight to make sure that Ontarians get the health care they need, when they need it, where they need it, from a well-funded, accessible public health care system. This draft bill clears a pathway for privatization and would make it difficult or near impossible for many to get the care they need. It would increase costs for all and put Ontarians at the mercy of a for-profit healthcare system in Ontario, which is not what we wanted. Forced mergers and closures are not what Ontarians need. We need a plan for better publicly funded healthcare. Strong public services are a pathway to equality. Privatization means more Ontarians will be left out. I don't want to live in an Ontario where some have access to good medical care and others don't. The Labour movement has always fought for universal public health care, and we aren't going to stop now. If this government tables the material in this leaked document, it will have a fight on its hands right across the province of Ontario. The government said yesterday this is only a draft document. but most of you will agree, usually where there's smoke, there's fire. I don't believe conservative supporters in the June 7th election last year knew that they were voting for a government that would privatize our health care in the province of Ontario. And if they did, they should be very, very ashamed of themselves. That's not the type of province we want. That's not the health care we want for everybody across the province. Since the June 7th election, this government has showed its arrogance. They've showed that they're not in it for the people. They're in it for the wealthy. This government has catered to the large businesses. They've catered to the wealthy. As a labor movement, we're going to ensure that everybody is treated equally across this province and nobody is left behind. That's what we do at a labor movement. We're going to fight this privatization right to the bitter end. And whatever we can do to make lives easier for people is exactly what our plan is going to be. One has to question. I've been trying to meet with the Premier of Ontario since the day he was elected on June the 7th. Numerous attempts to sit down with the Premier of Ontario, all have been ignored. We've seen since the election the attacks on workers. We've seen how they've gutted Bill 148. We've seen how they introduced Bill 47 with 5 hours of consultation. As Sara has said, there has been no consultation on this draft legislation. And I would challenge the government to come clean and tell everybody in the province of Ontario exactly what their plans are. Because their plans are to privatize our precious healthcare system, and we're not going to stand back for it. This is not the Ontario we want for all people treated equally, all people being respected, regardless of their financial situation. So my message to the Conservative government and the Premier of Ontario, rethink your position. Rethink your position in your plan for our precious healthcare system in the province of Ontario. And for anybody who may be listening today, contact your Conservative MPP and tell them that this is not what you're in favor of. And if you voted for a Conservative MPP, remind them this is not what they campaigned on. This is our province, folks. This is our healthcare system, and we're going to fight like hell to protect it. Thank you very much.
I understand the bill puts a lot of power into the hands of the minister and the new super agency, but I don't see anything in it that explicitly says we're going to take this towards privatization. What makes you so sure that this is the government's plan and how to use that power?
It actually does give that in the bill because it gives the minister the power to actually to order services to be provided by any other entity. It speaks to individuals or entities. So the fact that there is absolutely no mention of, anything in the public interest, i.e., accessibility, universality, comprehensiveness, access to healthcare, none of those are mentioned in there. There is no democratic process. There's just on page 14 of the document, it speaks to this entity being the super agency being able to order full-scale other providers to take over the services as long as they take over, and it mentions a list of the different services that they can order an entity to take over, and it's home care services, it's it's psychiatric facilities, it's mental health, it's home care services, it's hospital services, it's all in the document. It absolutely does say that the super agency has that ability to do that, and there's absolutely no mention about public not-for-profit. So the direction is very clear in this document, in the perusal that we have done, and obviously it's an 80-page document, so there will be much more, and we will be commenting on it further once we've gone through the whole thing. But there is clear indication there on the abilities and the powers that the ministry has under this. We have not seen the likes of this in the province of Ontario in the past.
What do you mean by go to war with the government over parts of this, especially with home care?
Well, we will be escalating. We have done many rallies and demos. We have filled galleries in the past. We will be having discussions with our principals and with our members across the province, and we will make sure that this is something that every single person in their communities is fighting for. If this, I don't want to say days of action or mass demonstrations, but I mean, we can see that there are a lot of people unhappy in the province of Ontario over the decisions that were made over OSAP up and what that has created, and that similar will happen under healthcare. This is something that fundamentally every Ontarian believes in. It crosses all party lines. It doesn't matter if you're Conservative, if you're Green, if you're NDP, if you're Liberal. You believe principally in a public healthcare system and that people should not have to pay to get services. And so if they do try to privatize the likes of what they did in BC way back when Gordon Campbell was premier, people did mass demonstrations. People took to the streets. So we will escalate as we need to based on how far they go with privatization of our healthcare system.
All you have to do is look at the actions of this government since elected last June. Look at the attacks on the most vulnerable people in our society. Look at the attacks that just took place against our students. That's the future of Ontario. Our young people are going to shape this province. They're going to help remold it going forward. This government and their arrogance are turning their backs on working class people, whether they belong to a union or not. When you look at public funded health care, this isn't about unionized workers. It's about every person in the province of Ontario. It's about building the province we want. And nothing is ever perfect. But to have no dialogue with the Ontario Health Coalition, have no dialogue with the labour movement in the province of Ontario, to have no consultation on nothing, and most of the consultation are smoke and mirrors because this government from day one has had their mind made up. They're going to cater to business, they're going to cater to the wealthy, and they're going to leave people behind. And we're not going to leave anybody behind. And we are building coalitions, we are building partnerships, and we are building power on the ground floor with people in the province of Ontario. And our government needs to realize that. Yes, they've got a green light, a majority government for 4 years. 4 years goes very quickly, and we're not going away.
The minister yesterday said that OHIP is not part of this legislation. They're not looking at changing or tinkering with OHIP. How would that change the patient experience if some of these services were delivered by private entities?
What we have seen over the years in services that have actually been moved out of hospitals into private clinics is we see people that have to pay user fees, that routinely they are going to clinics, and the Ontario Health Coalition released a report a few years ago and made phone calls to every single private clinic in the province of Ontario, and the majority of the private clinics are charging some kind of fee. So people are expected to show up and produce their credit card. They call them block fees, they call them booking fees. There is some kind of fee. Some of the tests people are paying for out of pocket. Lab diagnostics tests, you're seeing fees where people can jump the queue, that if you have more money, you can jump ahead. And the whole system of public health care is that it is delivered in as a needed basis. You're triaged. Those who need the care the most urgently get the care first, and we go down as we need to. But when you are able to just pay out of pocket and you can pay a fee and you can jump ahead of someone else, that puts the people that need the care the most at the bottom of the line. In BC, and I'm going to keep mentioning BC because that's Gordon Campbell came from British Columbia, and all the indications he was appointed as the financial czar. Then we appointed, had the Ernst & Young line-by-line review. The Ernst & Young report that was released, mentioned that there would be means testing of universal programs. The universal programs that we have in the province of Ontario are healthcare and education. So if we're now introducing means testing, people will be paying. While you may still have an OHIP program, it doesn't stop from double billing, extra services, and user fees on top of that. And in fact, that's what happened in BC under Gordon Campbell. Gordon Campbell moved a lot of diagnostics and surgeries out of hospitals into private clinics where people were charged thousands of dollars in order to get those services. So that is a very real and present threat we view because of the people that are actually in charge of this whole review and this transformation. So I think that, it is safe that, to make the assumption, and based on how this legislation is written, where there are overarching sweeping powers with no democracy, no consultation, we are right to be very, very concerned about what the direction is for healthcare in the province of Ontario.
Thanks, folks.
Pretty succinct. Thank you very much.
Thank you very much.